An intensely difficult year caring for patients, nurses are asking for something from us. They want their voices heard when talking about their struggles, ones that have only gotten worse during the pandemic. Madeline O'Neill was at a Nurses Week Speak Out event at the Capitol today and joins us with their message. Maddie.
Governor Tony Evers and Mayor Satya Rhodes Conway were among speakers at this event at the Capitol today, honoring nurses for all of their hard work during the pandemic. But beyond that, nurses are pushing for change as they care for patients.
I learned in nursing school that we must truly be advocates for our patients day in and day out. But also, I realized during the pandemic, we need to be advocates for ourselves.
It's so important to recent nursing school graduate Ian Todaro that he's missing a special day to be here.
Instead of at Camp Randall for graduation.
After an extraordinary year.
I have a lot of colleagues in the ICU, the ED, all over the hospital who now have PTSD.
Added a lot of stress. The toll of knowing that I'm not safe when I go to work.
Nurses brought their concerns to the Capitol, calling for what they say is lacking in hospitals, PPE, and staffing.
It's a lot more dangerous for those people to receive care from nurses that are overwhelmed, understaffed, and don't have the right resources.
UW Health nurses in particular are again calling for a seat at the table, asking administration to recognize a union voice.
My father actually was a nurse at UW for most of his career, so I grew up watching what the union could do.
When we had a union,
UW Health's nurses union was disbanded after Act 10 in 2011. UW Health has told us in the past that the legislation prevents them from recognizing a union, though SEIU Healthcare in Wisconsin, the state's largest healthcare workers union. And these nurses disagree.
For my parents, this was a lifelong profession. And now when I talk to nurses my age and younger, people can't envision that future for themselves anymore.
A UW Health statement says that, quote, leaders and staff nurses have been working together directly and collaboratively to meet the needs of our patients while following all state laws on collective bargaining. These nurses say that's not enough.
And not having a seat at the table doesn't allow us to engage in the care that we give.
Governor Evers' upcoming budget did call for expanding collective bargaining, but the Joint Finance Committee scrapped that earlier this week. Now, you might remember Meritor nurses and their union recently came to an agreement with that health system, getting increases in sick time, vacation time, and pay.
Thank you so much, Maddie.